welcome to BNEWS Weekly. I'm Phil Gallagher, along with BNEWS Director Rich Hosford, BNEWS reporters Tad Stefanek and Robert Paris. Thank you for joining us. The COVID-19 pandemic and the response to it continues to have a big impact on everyone's lives and the economy and the news reports. This week, Governor Charlie Baker extended the stay-at-home advisory and the closure of non-essential businesses to May 18th. That means restaurants will continue to operate in a limited capacity, takeout only, if at all, and all hotels are closed to all with the exception of emergency workers. Here in Burlington, that means the income generated from the meals and hotel taxes and water and sewer is being greatly impacted. And to add to that is the expected property values are likely to fall, and big property owners will be requesting a reduction in taxation levels perhaps, but not until fiscal 22. All of this is going to have an impact on the town's revenue, tax revenue, just as town meeting is gearing up to pass the FY21 budget. One person who's been studying this situation and I'm sure has a few extra worry lines and is preparing steps to reduce the impact is town accountant and assistant town administrator John Denizio, who joins us now through video conference. How are you, John?
Good, Phil. Thanks for having me.
Thank you for joining us. Okay, this week you gave a system-wide, department head-wide, a memo updating a strategy. Could you recap that for us?
Sure. So we shared the memo with the Ways and Means and the department heads and then presented to Board of Selectmen on Monday. In the memo, it just outlined what our plan was for this current closing out this year and for the revenue side of the budget next year and then beyond. So in a nutshell, the plan was that we think we're going to be able to close out this year without much of a problem. We don't anticipate there being a deficit. We have incurred some costs, but we've also put a spending freeze on, and we think we'll get through. The state has agreed that they're not going to, well, up to now, has agreed they're not going to adjust state aid for the current year. And we, in local receipts, we've already made our budget number for the year as of March 31st, which is typical for us. So for FY20, we think we're going to be okay. For FY21, what we outlined to the Board of Selectmen was, well, we took a hard look at the revenue numbers for 21. We don't have a crystal ball, but we did make some assumptions. So two of the places where we looked to adjust were in local receipts and in state aid. And for those that don't know, local receipts are things that aren't residential taxes, but it's money that we collect, such as occupancy tax from hotels and motels, meals tax from restaurants, excise tax from sale of cars, permits, building permits, water charges, investment income, things like that. Luckily, in Burlington, we have been, for a long time, conservative when budgeting those numbers for just this reason, for something like this comes up. In a typical year, the past few years, we've beat that number by some $4 million to $5 million. Hence why we made our number on March 31st this year. So what we did is we took a look at that number, which we had projected to increase by about $500,000, which has been typical for us the past few years. And we said we could level fund that number. And what that meant was we could absorb a lot more than that $500,000 because we could absorb about a 27% cut from actuals from 19 to projected for 21. And like I said, we collect $4 to $5 million more than that number every year, and we budget like that because, well, that the bulk of that extra money comes in hotel, motel, and building permits. And when there's a downturn, those are the things that go away first. So we think we're in pretty good shape next year with that at level funding it. Again, with state aid, the same thing. We're looking to level fund that. That's a couple $100,000 difference from what we had in our projection back in December when we set our guidelines. So the experts are all over the board with this one. Some saying that we're going to have a 10% decrease in state aid, and some are saying that the state will probably hit the rainy day fund to hold harmless at least the Chapter 70 portion of state aid. So we do expect there may be a cut, but hopefully not as bad as the 10% they're projecting.
So how does that revenue break down, John, from local tax levy, the outside local options, and the cherry sheet. How do those three figures mesh together? What are they totally? What are we spending, 159 million?
Yeah, so in the 150s, the breakdown for our projection for next year is it's about 16, almost 17 million in local receipts for our budget, about 10 million in state aid, and then the rest from property taxes, which is about 123 million. There's also some free cash that we spend on free cash items. We use one-time funding for one-time expenses. We do the pay-as-we-go capital, as you know, from being our Ways and Means. And then there's a piece from special revenues we spend, that's another $1 million. That is predominantly Chapter 90 funds that we get from the state.
Chapter 90, and that is highway funds?
That's for roads, yes.
Okay. Now, we still have some discretionary funds that may or may not be spent in the form of warrant articles. I guess the budget's pretty solid at this point. The only one remaining, I think, is the school budget to approve. What is your thought process? I know Paul Sagarino had said perhaps a little caution going into June, the June meeting, and perhaps into September. Is that still the goal?
That is, and Paul has directed the departments to take another look after talking with Ways and Means and Board of Selectmen, and we could see there was some concern there. So we presented about almost $4 million worth of free cash warrant articles. We're taking another look at those and seeing how many of them can be put off till September, put off till January, put off till January, or potentially put off until next year. So everybody's taking a look. We've already done some of them. We're not done yet. We expect that number to be in the 7 figures. So a significant cut in that. We're not done yet, but we'll be there soon.
Great. Well, get back to the grindstone. And once again, thank you for your time. And thank you for joining us.
Great. Thanks for having me.
Take care. We go now to our weekly COVID-19 update with Dr. Wayne Saltzman of the Burlington Board of Health.
Hi, Phil. Thanks.
Informed, feel supported, and be prepared around this COVID-19 pandemic. As in previous weeks, a number of new issues have come up that I'd like to talk to you about. But first, as always, let's talk about the numbers. Across the world, greater than 3 million confirmed cases of COVID-19, but over 1 million people have recovered. In the United States, 1 million confirmed cases from 6 million tests. And in the state of Massachusetts, 275 tests with 62,000 confirmed cases, 12,000 confirmed cases in long-term care from both residents and healthcare workers. 57% of the deaths in Massachusetts from COVID-19 have been due to folks who live in long-term care settings. And I have to tell you, as a geriatrician, I have spent the majority of my career in these settings where people call home. And I know of their vulnerability, and now we all know because of COVID-19 about their vulnerability. And I think we all can appreciate now how it's going to take a village to pay a little bit more attention to these folks moving forward. As we know, the national mandate for mitigating COVID-19 has been lifted, and states are pretty much on their own for dictating their paths. And Massachusetts is taking a judicious path to make sure that when we do emerge, we're safe in doing so. And the Burlington Board of Health is upholding that guidance. But there have been some issues and concerns about wearing masks in public. As you know, I am an advocate, and I do wear a mask in public. Folks have thought that we should mandate masks as they have been in other towns. As we talked about at the last Burlington Board of Health meeting, and as our selectmen discussed, the idea of mandating is difficult. How do we enforce it? What happens if somebody isn't wearing a mask? What do we do? I am still for the understanding that we are all citizens within a community, respecting each other and wanting each other to be well. And wearing a mask, along with social distancing and other precautions that we always talk about, is really the way I think we need to proceed. But the Burlington Board of Health is always willing to talk more, and we welcome comments. There's been more information about treatments. Remdesivir is the latest medication that's in the news. It has been shown in appropriately run clinical studies that it may reduce the number of days of recovery, which is great. And if anything, we should all be encouraged that clinical studies are underway. Nothing definitive yet, but at least people are actively focusing on how to treat this disease. With regard to vaccinations, we heard that the central administration believes that perhaps because of the work that's being done across the world, in the January of 2021, we may actually have a vaccine. Again, wonderful. But remember, it takes time to make sure something is safe, effective, and can be produced in large quantities. I hope that we're there in January. But until then, same issues apply, issues that should now be part of our normal lives. Hand washing, hand washing, hand washing. Protecting your cough and your sneeze. If you're sick, quarantining yourself, cleaning surfaces, social distancing. If there is an older adult that you think could be helped by your call, please make a call. We're all in this together. Stay safe and be well.
The courts may be closed, but the work of District Attorney Marian Ryan's office continues. BNEWS Director Rich Hosford spoke to her over video conference this week and started out by asking how the pandemic has affected operations in her office and among law enforcement. Here's what she has to say on that subject.
Of course, like everyone, we've been sort of switching to this new world, a lot of which is remote. And the courts, most of the physical buildings are closed, but work is still going on. So that's one of the messages we want to get to people that, if you need help, if you need a restraining order, if you need to section somebody in the family, something like that, we're open for that. It looks a little bit different because you're doing it maybe from home or you're doing the hearing as we're doing this on a Zoom call.
Times of uncertainty are ripe for people looking to make a quick buck, taking advantage of people's anxieties and their desire to help those in need. DA Ryan outlined some of the scams she and law enforcement are seeing related to the coronavirus.
3 different kinds of scams. One has been around the stimulus checks that the federal government's been sending out. So people have reported getting calls. This is the federal government calling to check, confirm your social security number, confirm your bank number, all of that kind of information that we don't want people giving out. So that stimulus check is going to just show up either in your bank account or in your mailbox. You don't have to do anything. You don't have to provide any information. So if you get a call that someone's looking for that information, that is 100% a scam. The second is people are really capitalizing on folks, especially seniors, being afraid about the virus and making pitches about either they've got a good test or they've got a vaccine or they've got a drug. And those things just aren't out there for the public to buy. So that is also a scam. And the third, and in some ways the worst, is people are so generous, and people are donating money to help those who are out of work. So a lot of it is calls to donate money or resources to people that may have lost their job or are hungry. And most of that money is probably not making its way to the people you intend. So if you want to make a donation, you should use charities that you know, or go to established websites and things to make a donation.
Sheltering in place is difficult for everyone, but the loss of work and the anxiety of the current situation can be especially difficult for people suffering from addiction. DA Ryan said that her office is still working hard to ensure that people trying to fight opioid addiction and their loved ones have the resources they need. Here she is.
People are still getting into treatment. We really want to stress that. We did one of our opioid task force meetings on Wednesday, I guess, with over 150 people, sort of everybody impacting this issue. And lots of the providers talked about how they are still successful in getting people into treatment if this is the moment when you're ready. We also have folks that are still willing to give rides to people if they need to get to treatment. We've been, as we always do when there's a concern, talking to the people who love somebody who's struggling to really make sure they have their Narcan. And we are making Narcan available through all of this crisis. So if folks need to do that, you can reach out to the police department, you can reach out to us, we're making it available. Make sure you have it, check on people. This is hard on everybody. And this is also the time when we get worried that people might be concerned or depressed or upset about a lost job or any of those things, and it might trigger an urge.
The DA's office has created a new non-emergency text line for victims who need support and services. Anyone can reach out to them for help at 781-281-4066 to be connected to a victim advocate. Despite a record-breaking relief package from the federal government, the state of businesses in the country, and including here in Burlington, is not healthy. Burlington Area Chamber of Commerce President Rick Parker told BNews that issues with getting assistance from the stimulus package has been the #1 topic of conversation among small businesses here in the past few weeks. The big issue was the Paycheck Protection Program that initially had $349 billion in stimulus funds that were meant to go to companies with 500 employees or less. Those funds, as reported widely, quickly dried up, and in many cases, larger companies ended up with large sums of the funds, including some universities with large endowments. Also, some states received more of the funds than others, and Massachusetts has been on the losing end, garnering only $10 billion of the total amount allotted for the program. Rick Parker said the problem appears to be that funds went first to banks already associated with the Small Business Administration, or SBA loans, and many of those banks had existing relationships with larger companies. He said that in this next round of funds disbursements, which began Monday, he hopes there will be more equitable and benefit the small businesses the stimulus package was created to help. The analysis of the issues facing local businesses is extensive, and you can read more about it on our website at bcattv.org/bnews. AFC Urgent Care has been holding drive-up testing in different locations around the area. BNews reporter Tad Stefanak went to check one out and get tested himself, and he files this report.
In the battle against COVID-19, Burlington is fortunate to have two soldiers in our corner. David Adams, president of AFC Urgent Care, served as an officer in the United States Marines, and Dr. Christina Oreo, who saw active duty as an emergency medicine physician in the Air Force. Dr. Oreo likened COVID testing to combat experience.
In many ways, it's very similar. I mean, we are fighting a war here, against a virus every day. And when we run these large-scale drive-through events, it is like running a mass casualty exercise in many ways.
Large-scale drive-through events we're running now, we're actually taken out of the military playbook. Dr. Oreo and I both ran a lot of mass casualty and a lot of vehicle checkpoint events, and to be able to apply those same principles to a large-scale drive-through testing event creates a safe environment, and it creates a safe, healthy environment for the patients too.
With our 6 clinics, we're rotating our large-scale drive-through events, and we're doing 3 a week in different locations so that we can contact multiple communities and try to get as many people tested who are symptomatic as possible.
AFC Urgent Care is especially equipped for COVID testing.
We're one of the few locations in the state that has access to the Abbott Labs rapid molecular test, largely because there's a shortage of machines, and we have plenty of the machines because for many months we've already been using that same machine and the same technology to provide molecular flu testing for the communities. And so we were able to convert those machines and upgrade the software in those machines to be able to use the rapid COVID test that we believe, based on its technology, is approximately 98% sensitive. It's a very accurate test.
The process for being tested starts with a phone call.
The patient calls us, we send them a text to their phone, they open up the text, and they can immediately be in the application and see our provider on their phone, and our provider can talk to them about their symptoms, their exposures, and determine whether or not they should come through our event.
This reporter followed drive-through procedure and was tested for COVID-19.
The patients arrive on site to the security checkpoint where they present their ID and show us their doctor's order that we've presented to them during their telehealth appointment the day prior. They move through the registration process.
How's it going?
Good.
So I just have your registration form here.
confirming their identity, and move to our triage station.
Thank you. My name's Casey. This is Bree, okay?
Hey.
We're going to do your vital signs, okay?
Triage, they are tested for COVID-19, they're tested for rapid strep, their vitals are taken, and from that station they can move into the examination space where our providers can counsel those patients, can examine those patients, can confirm vitals and make sure the patients are feeling okay.
Have you had any fever or chills?
Nope.
Any chest pain, shortness of breath?
Nope.
Any cough?
Nope.
Any sore throat?
No.
And most importantly, that the patients have a clear understanding of what the CDC guidelines are around isolation and quarantine.
You need to stay in quarantine for 7 days from symptom onset.
We then take those results, and we are taking those results, communicating those to the State Department of Public Health as we are required to do, and also to the local public health department as we are required to do, so that those two entities can contact trace the patients effectively and keep, again, those communities safe.
If you develop severe shortness of breath or chest pain, you'd want to go to the emergency room. I'm just going to listen to your heart and lungs, okay?
We're very busy. We're running about 200 to 300 patients every time we run these events. What we're seeing is about a 30% positivity rate, which is high. But what this allows us to do as well in these drive-through events is to do a brief exam on patients and make sure that their vital signs are stable, make sure that clinically when we listen to their heart and lungs that they're doing okay. And it also is a really important contact point for us to counsel patients on self-isolation and quarantine, whether their result is positive or negative, what they need to do. And it's a point in time where patients can ask our providers some questions on how to do that.
AFC Urgent Care is also preparing for post-COVID healthcare.
We believe in the coming weeks we are going to be testing also for antibodies, likely with another rapid finger prick test. And so we will be able to test 200 to 400 patients a day using in each of our locations, covering testing for both the active live virus and antibodies to see if they have been infected and likely have developed some form of immunity to the virus.
Thankfully, this reporter tested negative for COVID-19 and strep throat. And BNews sends its thanks to all the healthcare heroes on the front lines. From AFC Urgent Care in Stoneham, I'm BNews reporter Tad Stefanak.
The Burlington 4th of July parade has been canceled, but they are talking about holding an event later in the summer or fall if the situation changes. In a letter, Terry Tarpey Clement, co-chair of the Burlington 4th of July Committee, said that with a heavy heart, the committee informs the public that after a lot of thought and consideration, they have decided to cancel the parade for this year. The cancellation was also discussed at Monday night's Board of Selectmen meeting when they were going over town meeting warrant articles. When they looked at a line item for $20,000 for the parade, Selectman Mike Runyon, also a member of the committee, said they were withdrawing it due to the parade cancellation and because they are trying to reduce spending in town due to a forecasted lack of normal tax income from meals and hospitality taxes. However, he said they are thinking of having some sort of a celebration, if it becomes safe to do so, later in the summer, to recognize people on the front lines, including healthcare workers and grocery store employees. He added that they also want to recognize the Burlington High School class of 2020 graduating seniors. We'll have more on those plans as they develop. During this pandemic, many people are stepping up to lend a hand. Chris Toda, a Burlington science teacher, is out to help provide our essential workers with the protective gear they need during COVID-19. He joined with a nationwide organization called Goggles for Docs to get protective equipment to healthcare workers. BNews reporter John Vias has this report.
Theater and first responder has been working to organize a drive for some much-needed protective equipment, goggles. He has been encouraging people in the Burlington area to donate ski goggles for a nationwide drive called Goggles for Docs.
It really came out of the ski industry. So I'm sure everyone's heard there's been a nationwide shortage of PPE, which is the personal protective equipment. So specifically in terms of eye protection, goggles are definitely a shortage. And if there's one thing a lot of skiers have, it's plenty of extra goggles. So this was really like a grassroots movement that actually started on Facebook from a doctor in the Bronx, I believe, who needed eye protection. And it kind of just grew from there.
Volunteers across the country are running separate drives for healthcare providers. Chris, a longtime member of the National Ski Patrol at Wachusett Mountain, got involved in a drive with fellow members there and decided to bring the idea to Burlington and enlisted fellow teachers at Burlington High School to help.
So we kind of just extended that down to Burlington and set up a donation booth and talked to some of the department chairs as well, had jumped in on it. So we ended up starting collecting in Burlington that way, and we got quite a bit in the first week of collection there too.
In only 4 days, they were able to collect about 3 dozen pairs of ski goggles and a variety of other types of facial protection gear with a drop-off bin outside the high school. They were also able to gather PPE from the school's science departments.
People also had like old lab goggles, which are great too, that they had donated. At the middle school, some of the science teachers actually were able to donate probably about 30 or 40 lab goggles from Marshall Simons. And then same thing at the high school. We probably had about 40 or 50 lab goggles that hadn't been used in a few years that we were able to donate, as well as about 15 full face shields that cover your face too.
The goggles were given to healthcare workers at the makeshift hospital at the DCU Center in Worcester, Massachusetts, and to members of the Burlington Police Department. There are also plans to collect face shields and ear protectors to the Burlington Fire Department. Future donations will likely go to Leahy Hospital and Medical Center. All in all, Chris said he's been happy to see so many people willing to help out.
I mean, I think it's a great public service. You know, I think this is really a time of need, and kind of this whole Goggles for Docs program is a grassroots thing to begin with. So I think it shows, especially like in Burlington, that the community is close knit and are working together to try and solve a problem and help those out who are on the front line. So I think that shows a lot about our community and how great it is and how caring people are.
Currently, the donation bin has been taken down from the high school, but could be put up if a specific need were to arise. Anyone interested in helping out can visit gogglesfordocs.com to find out where donations are needed. This is John Vias for BNEWS Weekly.
COVID-19 has been affecting everything and everyone worldwide, including the local performance group, the Burlington Players. BNews reporter Robert Paris spoke to the organization's president about what they are doing during quarantine and their hopes for the future. Let's have a look.
As the world continues to fight against the coronavirus pandemic, many establishments are waiting to reopen their doors, including the Park Playhouse, where the Burlington Players perform.
Well, unfortunately, it means we haven't been able to gather to continue rehearsals, and obviously we don't have any audiences coming into the theater. Obviously, it finalizes our cancellation of our plans.
The Players' recent production had to be halted due to COVID-19.
I mean, one of the big ones was with the cast of Bridges of Madison County, because that show had already been selected. We'd already done the auditions. We'd already selected a terrific cast for that. They were already well into auditions, rehearsing their music and their blocking, and working with the director on the acting and movement. So it was, kind of a shock to them that we had to kind of halt rehearsals and stop that progress. But they're such a good cast, and they were so invested that we wanted to move the show to September so we could keep as many of them working as possible.
The volunteers at the Playhouse are keeping it in tip-top shape.
We do have an opportunity now. We realize it. We've discussed it as a board with kind of this downtime for individuals to go in one at a time, so there's proper social distancing, and do some small projects in the theater to try to clean it up. Obviously, to clean it up germ wise, but also just to try to weed through some things that are there and clean up the physical plant, just make sure it looks better and it works for us better. We also are looking at possibilities for some redesign in the theater space itself. And of course, we'll have to go back to the town to see if they would approve of whatever plans we might have. But that's something that we're looking at, because we want to take advantage of this time, as long as it's socially the social distancing involved.
A decision of having another production this year is still up in the air, but as of right now, they're moving their spring production to this September.
The board, recognizing that this was a possibility or probability, has already talked about contingency plans. We're planning for next year. So what we're going to do is take the show that we were going to do in May, Bridges of Madison County, and move that to September, and try to make next year's season starting in September, if that's possible. And of course, we don't know anything at this point. nobody has a crystal ball on this one. But we're hoping to be able to do a full season next year.
Lastly, the players cannot wait to entertain residents in the future.
Personal level, I am looking forward to just being able to go to the theater and see people rehearsing, to hear people in musical rehearsals for Bridges, and to see the directors start to get together with their production teams and start to plan their productions for the course of the year. And we hope that it's going to come true. We hope that this pandemic is really getting under control and that it'll be safe to go back, to start to rehearse again, and for audiences to come in back to the theater.
I'm Robert Paris for BNEWS Weekly.
For the first time after 32 and a half years, a Burlington detective walked out of the Burlington Police Department no longer a full-time member of the force. Detective Jim Tigas officially retired from the department on Thursday, April 30th, though he will remain connected to his former career as a special police officer and educator. Tigas was first appointed as a permanent intermittent reserve in 1987 and became a patrolman in 1988. As a patrolman, he graduated from the Somerville Police Academy. He was part of the department's motorcycle unit from 92 to 96, and then worked in accident reconstruction from 96 to 2006. He also worked as the scheduling officer starting in 2000, a job he would keep before applying for and becoming a detective in 2014. When asked what he will miss the most, he said, without hesitation, his fellow officers. He said he views the ones he's worked with for a long time as his brothers and sisters, and the younger officers as his sons and daughters. He will also stay connected to his former career by teaching new officers through the Mass Police Training Council that oversees numerous academies. He was also appointed a special police officer at Monday night's Board of Selectmen for the Burlington Police Department. In that role, he would do details and work at events and other similar activities. Here is Chief Kent at that meeting talking about Jim's demeanor as an officer.
You'd never see Jimmy when he doesn't have a smile on his face and a positive word. And he would get into work early, 6 a.m., and I'm an early person in the work also. And he was always the first person I saw when I came in the morning. And it was always just a nice way to start the day.
The chief also talked about Jim's work as a detective.
He was appointed as a detective, and just as in the scheduling job, he did an unbelievable job. Jimmy, as a detective, thorough, tremendous with the public. If I had something that I needed a little extra attention put to, I always shuttled it Jimmy's way. And as in every job that he's held in this department, he shined as a detective, and he's going to be a major loss when he retires.
Fellow members of the board also praised Jim's work with the department. Here is Selectman Nick Priest, a son of a retired police officer, speaking at the meeting.
I think it goes without saying that the town of Burlington has been lucky to have the people we've had, in these roles, serving the community, and that goes for Jim. He always puts his best foot forward and is always striving to better the community. And that shows in his actions and the things that he's done for this town. And so, Jim, from the bottom of my heart, I say thank you, and enjoy retirement. Enjoy that next journey in your life.
We had an in-depth conversation with Jim about his career and thoughts on retirement. You can read the full article on our website at bcattv.org/bnews. The police department is looking for information on an abandoned boat left near the power lines on Wilmington Road. Hey, Captain Ahab, police tweeted on Monday. Abandoned ship doesn't mean illegally dumping your boat by the power lines. Some people are idiots. They didn't tweet that. Police say the boat, a Galaxy Bow Rider, was dumped on Sunday, March 26th at around 8:45 a.m. The suspect is a white male with glasses driving a maroon Dodge pickup truck. Police asked that if anyone recognizes the boat or notices an empty boat trailer parked in a neighbor's property to call them at 781-272-1212 to discuss their poor navigational choices. Police also noted that the hull identification number looks to have been scratched out in an attempt to hide the boat's identity. Another week, another photo to highlight. This week's photo is a pretty scene that we hope we don't see again in person for a while. It was sent in by Ruthie and Nettie. Yannetti and shows a magnolia tree covered with snow-covered blossoms from the late snow we received recently. Now let's get on to some real spring weather. Thank you for the photo, Ruth. We'd like to see your photos. They could be of your stay-at-home activities in the house, shots of your pets, the coming signs of spring, or just the weather scene from your own back door. Whatever you think is interesting and want to share with us in the community. Email your photos to bcat@bcattv.org with the subject line Photo of the Week. Okay, special thanks to Chris Flaherty, Jen Dodge, and Robert Paris for making this week's, where am I, Robert? There we go, this week's program possible. Thank you for joining us.